Good day everyone, I'm Jaira Sarmiento together with my group mates Christian Ivan Gawat and Joella Marie Lamsen, and we're here to present to you our topic about dosages and solutions and giving of medication, all routes and 12 rights.
For the dosages and solutions, we have first the dosage. This is the size or frequency of a dose of a medicine or a drug. For example, 2.5 ml twice a day. And for the dose, this refers to a specified amount of medication taken one at a time. For example of this is the nurse is giving morphine to the patient. And for the abbreviation used in drug preparation and administration, the abbreviations rule the medical world. It is important to know and recognize abbreviation in clinical settings so you will not be lost when preparing medications for the patient. Here are the most commonly used abbreviation when preparing the drugs. First, we have the routes. The most common, the intramuscular. This is often abbreviated as IM, and this is injection of a substance into a muscle. In medicine, it is one of the several methods for parenteral administration of medication. And also, this is preferred because the muscles have larger and more numerous blood vessels than subcutaneous tissue, leading to faster absorption than subcutaneous or intradermal injections. And the common sites for intramuscular injection include the deltoid muscle or the upper arm and the gluteal muscle of the buttock. Also in infants, the vastus lateralis muscle or of the thigh is commonly used. Second, we have the IO or intraosseous. This is a process of injecting medication, fluids, or blood products directly into the marrow of the bone. This provides a non-collapsible entry point into the systemic venous system, and this is also a technique used to provide fluids and medication when intravenous access is not available or not feasible. Next one, we have the IV or the intravenous. This means within a vein. Most often, it refers to a giving medicine or fluids through a needle or a tube inserted into a vein. This allows the medicine or the fluid to enter your bloodstream right away. Next, we have the IVP or the intravenous push. This is a rapid administration of a small volume of medication into the patient's vein via a previously inserted intravenous catheter. This method is used when a rapid response to a medication is required or when the medication cannot be administered via oral route. We have the intradermal, and it is often abbreviated as ID. This is a shallow or superficial injection of a substance into a dermis, which is located between the epidermis and the hypodermis. This route is relatively rare compared to injection into the subcutaneous tissue or muscle. Next, we have the intranasal, and this is described as an effective route to deliver drugs into the systemic circulation, resulting in rapid onset and higher drug bioavailability than classical extravascular administration routes. Next, the intraperitoneal. This means within the administration through the peritoneum. And this is a thin, transparent membrane that lines the walls of the abdominal cavity and encloses the abdominal organs such as the stomach and the intestines. We also have the intrathecal. This describes the fluid-filled space between the thin layers of tissue that cover the brain and the spinal cord. Drugs can be injected into the fluid or the sample of the fluid can be removed for testing. Next, we have the IVPB or the intravenous piggyback or secondary infusion. Is the administration of medicine that is diluted in a small volume of the IV solution through an established primary infusion line. The piggyback can be administered by the gravity or via IV infusion pump. Next, we have DPO or the per rm, which means by mouth. This medication is taken by the mouth. Next, we have the SC or subQ. Subcutaneous means under the skin. In this type of injection, a short needle is used to inject drug into the thin tissue layer between the skin and the muscle. Medication given this way usually absorb more slowly than if injected into the vein, sometimes over a period of 24 hours. We have the sublingual. This is a way of giving medication through the mouth. It involves placing the drug beneath the tongue to be absorbed and dissolved into bloodstream through the mucous membrane. These drugs are in the form of tablets that dissolve, sprays, or even films. Lastly, we have the topical. Topical, this is the medication that is applied to a particular place on or in the body. Most often, topical administration means application to the body surfaces such as the skin or the mucous membrane to treat ailments via a large range of classes, including creams, foams, gel, lotions, and the ointments. This is the most common measurement used. First one, we have the kg or the kilogram, the gm or the gram, mg milligram, mcg the microgram, MEQ is milliequivalent, L liter, ml milliliter, UG stands for microgram, GTT is for drop, UGT is for microdrop, and TBSP is for tablespoon, TSP is for teaspoon, and mg or DL, this is milligrams per deciliter. For the next one, we have commonly used units. cc for cubic centimeter or cm3, ml for milliliter, U for micro, GTTS stands for drops, G is for gauge, U is for unit, mg for milligram, G for gram, kg for kilogram, and MEQ is milliequivalent.
Before mastering drug dosage formula, you should first learn how to convert the commonly used units of measurements in drug preparation. It is essential so you will not get lost between drug calculation as physicians commonly order a medication available in a different preparation. The most conversion factors you will use for drug dosage calculations are the following. For solid conversions, 1 grain is equal to 60 milligrams. Formula for this is multiply the mass to 60. 15 grains is equal to 1 gram. Formula for this is divide the mass to 15.432. 2.50 per centimeter is equal to 1 inch. Formula for this is the number of centimeter times 0.39. And 2.2 pounds is equal to 1 kilogram. In liquid conversions, 30 ml is equal to 1 ounce. 1 teaspoon is equal to 5 ml. And 1 standard measuring cup is equal to 240 ml. For mass, to convert kilograms to micrograms, the formula for that is multiply the number by 1000. And for micrograms to kilograms, formula for that is divide the number by 1000. And to kilogram to pound, formula for this is multiply the number by 2.2, and for pound and kilogram, formula for this is divide by 2.2. In volume, to convert kiloliters to microliters, the formula for this is multiply the number by 1000. And for microliters to kiloliters, the formula is divide the number by 1000. In time, to convert hour to minute, formula is multiply the number by 60. And minute to hour, the formula is divide the number by 60. Examples, let's convert 0.08 kilograms to milligrams. Formula for this is multiply the 0.008 to 1000 as said earlier. So 0.0008 times 1000 is equal to 8 milligrams. Next, convert 1000 microliters to milliliters. Formula, divide the 1000 to 1000. So 1000 divided by 1000 is equal to 1 ml. And last, convert 480 minutes to hours. Formula is divide the minutes to 60. So 480 divided by 60 is equal to 8 hours. Next, for drug calculation formulas, below are the important calculation formulas that you should know in preparing medications. In calculating tablet dosages, the following formula is useful. The formula for this is desired dosage divided by stock strength is equal of number of tablets. The desired dosage is the ordered dosage of the physician, while the stock strength is the amount of drug present in each tablet. Stock strength is also known as stock dose. For example, The doctor orders 1,500 milligrams of calcium carbonate for the patient, and the drug is available in 250 milligram tablets. So how many tablets should be given to the patient? The formula, as said earlier, is dosage divided by stock. So our dosage is 1,500, then divide to 250. So 1,500 divided by 250 is equal to 6. So 6 tablets should be given to the patient. Another example, the patient is ordered to have 2 grams of potassium chloride and the drug is available in 500 milligram tablets. How many tablets should be given? But first, let's convert 2 grams to micrograms. So 2 times 1,000 is equal to 2,000 milligrams. Then proceed to the next step, which is dosage divided by stock. So 2,000 divided by 500 is equal to 4. So 4 tablets should be given. Next, calculating mixtures and solutions. The following formula is useful in calculating mixtures and solutions. The formula for this is desired dosage divided by stock strength multiplied by stock volume is equal to solution to be given. The desired dosage is the ordered dosage of the physician, and the stock strength is the amount of drug present in the preparation, while the stock volume is the amount of the solution where the drug is diluted. Example, the physician orders 375 mg of cefuroxime for the patient. The drug is available in 700 mg vial. You plan to dilute it in 10 ml of sterile water. So how much should you give to your patient? Formula is desired dosage divided by stock strength multiplied by stock volume. So our dosage is 375, then divide it to 750. So 375 divided by 750 is equal to 0.5. Then multiply the 0.5 to 10. So 0.5 times 10 is equal to 5. So 5 ml should you give to the patient. And additional tips, as long as you know the basic formulas of drug calculations, you will never be lost in finding the desired dosage for your patient. The trick in mastering drug calculations is to know unit conversions by heart. Once you are regularly working in a clinical setting, you will get used to the common formulas used in determining desired dosages or IV regulations for the patient. And it takes a lot of practice to master drug calculations, and you don't need to memorize it. Answer practice questions at home, and in short period of time, it will just be a piece of cake for you.
Next is the 10 rights of drug administration. Nurses are primarily involved in the administration of medication across various settings. Nurses are also involved in both dispensing and preparation of medication. There are many ways to prevent medication errors, and one way of which is understanding the 10 rights of drug administration. Understanding the 10 rights of drug administration can help prevent many medication errors. Benefits are effective management of the illness or disease, slowed progression of the disease, and improved patient outcomes with few if any errors. Harm from medication can arise from unintended consequences as well as medication error, wrong medication, wrong time, wrong dose, and etc. Nurses who are primarily involved in the administration of medications benefit from this simplified memory aid to help guide them to administer medication safely. 10 rights of drug administration include: first, right patient. Ask the name of the client and check his or her ID band before giving the medication. Even if you know the patient's name, you still need to ask just to verify. Identifying patients accurately and matching the patient's identity with the correct treatment or service is a critical factor of patient safety. Patient identification mistakes can lead to errors in medication administration, incompatible blood transfusion reactions, failure to treat a serious illness or disease, medical treatment for erroneous diagnostic lab results, and procedures being performed on the wrong patient. Next is the right medication. The first right of drug administration is to check and verify if it's the right name and form. Beware of look-alike and sound-alike medication names. Misreading medication names that look similar is a common mistake. These look-alike medication names may also sound alike and can lead to errors associated with verbal prescriptions. Next is the right dosage. Check for the medication sheet and the doctor's order before medicating. Be aware of the difference between an adult and pediatric dose. Lack of essential medicines and improper dosage regimen may result in serious health problems, especially among pediatric patients and individuals with chronic diseases. Next is the right route. Check the order and appropriateness of the route prescribed. Confirm that the patient can take or receive the medication by the order route. To ensure patient safety, it is essential to correct procedure is implemented so that correct medicine is given in the prescribed amount using the most appropriate route. Before administering any medicine, the person carrying out the procedure must be familiar with the advantages and limitations of the prescribed route and know the indications, contraindications, and side effects of the medicine they intend to give. Next is the right time. Check the order for when it would be given and when was the last time it was given. Taking medicine on time as prescribed is essential to making sure your body has an effective amount of the drug at all times. If not, this can cause the disease to develop a resistance to the medicine or simply prolong the amount of time it takes to feel better. Next is the right documentation. Ensure you have signed for the medication after it has been administered. Ensure the medication is prescribed correctly with the start and end date if appropriate. Documentation communicates the what, why, and how of clinical care delivered to the patients. These records allow other clinicians to understand the patient's history so they can continue to provide the best possible treatment for each individual. Next is the right client education. Check if the patient understands what the medication is for. Make them aware they should contact a healthcare professional if they experience side effects or reactions. Patient education is a significant part of a nurse job. Education empowers patients to improve their health status. When patients are involved in their care, they are more likely to engage in interventions that may increase their chances for positive outcomes. Next is the right to refuse. Give the client enough autonomy to refuse the medication after thoroughly explaining the effects. Patients may refuse treatments for many reasons, including financial concerns, fear, misinformation, and personal values and beliefs. Exploring this reason with the patient may reveal a solution or a different approach. Next is the right assessment. Check your patient actually needs the medication. Check for contraindications and baseline observations if required. A thorough and accurate assessment is important because it helps differentiate the normal condition of the patient from the abnormal, and a comprehensive health assessment establishes if a patient needs diagnostic testing or additional medical care. Lastly is the right evaluation. Ensure the medication is working the way it should. Ensure medications are reviewed regularly, and ongoing observations if required. Evaluations help determine what works well and what could be improved in patient care. Thank you for listening.